Okay, great. Well, let's first talk about the phases of autoimmunity or the phases of systemic inflammation, the phases of inflammatory pain, the phases of fibromyalgia. All the autoimmune processes are factors of triggers of inflammation. Okay, you see these triggers in the yellow column right over here. It's these triggers that contribute to the autoimmune process of your thyroid, of your adrenals, of all the degenerative inflammatory processes that exist in the body. And this is the little card, little brochure of the lab I use to identify these triggers of inflammation. Okay, so most people dealing with high inflammation in the body, they're over here in purple land, degeneration, systemic inflammation, anything that ends with itis, and pretty much all disease processes have components of systemic inflammation in it. Okay, and everyone's over here, right? And so what we're taught to do is, if you take a steroid, there's people who get on prednisone for years and years and years, or when it's bad enough, you get on an immunosuppressant to suppress your immune system. What you're trying to do is mash down inflammation here, right? We're trying to mash it down. We're trying to mash it down. What ends up happening, if these triggers still exist, you're continuing to feed the inflammatory response, okay? And so I try to tell people you have to get to the bottom of triggers of inflammation first to really guide the body into remission. And both medicine and functional medicine providers alone, they'll tell you to take a plant or an herb or a medicine that'll mash down inflammation over here, right? But next thing you know is it's oh, my prednisone wore off, or it doesn't even work anymore. And that's because the triggers of inflammation are too aggressive in your body. And each video is going to talk more and more about identifying these triggers and how we improve these triggers of inflammation in the body. Because every single time, if you go after the triggers of inflammation, you will see improvement in your inflammatory symptoms, no matter the disease process. Okay? So again, this is the lab I use, Cyrex Labs. They won't care. I give these cards to patients and stuff all the time. And we're going to go over some of the lab work. We're going to go over really difficult cases that, like when you're looking at, for example, the viruses and infection. That's your long COVID aspect of systemic inflammation. That's your Lyme's or your parasites or your chronic viruses aspect of disease process. Okay, these are the triggers of inflammation, guys, not managing the inflammation after the fact. So I love this card. It shows so much. Most people with high inflammation, every inflammatory pain symptom you're dealing with, okay, is they're up here, right? And we have to address these triggers right here to pull the body into remission, pull them into this pre-symptomatic phase. When you're pre-symptomatic, guys, you're not dealing with inflammation in the body, okay? We're going to cover how to do that, all right? I'm going to post this video, and then we're going to post another video about addressing the dietary proteins, which is what I go after first to reduce triggers of inflammation. I'm going to do that video right now.